Alrighty. Hello and welcome everyone to today's webinar, Exam Room Design Insights. I'm Samantha Burke, Administrative Director at NERUCA, and I'm so glad that you could join us today. Now, before we dive in, just a few quick housekeeping notes to help you get the most out of today's session. This webinar is being recorded, and following the session, you'll be able to access the recording on demand through Zoom and on our YouTube channel. We'll have time for Q&A at the end, so feel free to submit your questions at any point using the Q&A chat box at the bottom of your screen. Now, for those who may be new to us, NERUCA is proud to be in its 12th year of serving the urgent care community across the Northeast. We work to strengthen and support urgent care medicine by providing grassroots representation at the local level, tackling legislative issues at the state level, integrating urgent care into broader public health initiatives, and delivering education and outreach to elevate the role of urgent care in the Northeast region. Now, we do this through programming, including today's webinar and our annual conference. And our next conference, which is NERUCA's signature annual event, is just around the corner. We'll be gathering next week, September 28th through the 30th, at Foxwoods Resort and Casino in Connecticut, and we hope to see many of you there. Now, lastly, I would like to thank our corporate sponsors for their continuing support. A quick shout out to Aptitude, BD, BioReference, XDion, Fresh Paint, HealthTrack RX, Metro Health Bill, Pfizer, Solve, Medline, Healthium AI, and of course, a special thank you to today's sponsor, Midmark Corporation. And with that, it is my distinct pleasure to introduce you to Ron Myers.
Good afternoon, everyone. Thanks, Samantha. Appreciate the introduction. I have my colleague Nate Williams on with me today too, and we plan to share some insights with exam room design and how it may relate to urgent care centers specifically. Our agenda today is really to talk about just some industry trends and news that we're seeing through our lens and see if that connects with what you're seeing on your day-to-day. Do a little bit of a highlight on ADA compliance requirements and some of the changes that are coming down from the government. We'll look at some better blood pressure capture and EMR integration, and then highlight some clinical workflow and design services and some different resources that Midmark has to offer as you're working on new practices, growing and expanding your footprint. And at the end, as Samantha mentioned, we'll have some questions and answers, and feel free to ask us some questions down the road. So a lot of times we like to start, before showing exam rooms, really what we're seeing in the marketplace, right? Healthcare has been changing rapidly over the last decade, and there's some specific forces that are driving change. Change when you think about healthcare day to day, but also change in the design and when you're setting up a new practice. One of those, the first one we look at is really systemness and modernization. And what that means is as you develop multiple locations, creating standards across the board, right? Creating standards for your staff, creating standards for your patients. So if they walk into one location, everything has the same workflow, design, same cadence behind it. So that's really important if you're looking at multiple locations and trying to create that standard footprint, that standard workflow across the network. We also look at how value-based care is driving some change as well, and lowering costs of sites of care and what those reimbursements may look like. And then we know there's an unprecedented growth with non-traditional providers. And I think this is a real good connection to urgent care specifically, right? Because you think about retail clinics, urgent cares, you're really creating a competition against the IDNs, right? So creating that local care, something that's easier to access for your patient population. And we're seeing a big trend in this, and really patients moving to this model as well. And then the acceleration of technology going in exam rooms, right? Computers, electronic medical records, how technology can improve, make your practice more efficient, and even AI playing a more significant role today, as we all know. And then lastly, post-COVID impacts. So there's some different ways that, COVID has impacted, number one, the design of exam rooms with the way you clean and keep these facilities, reducing cross-contamination and infection prevention facilities, but also staff burnout too, coming out of COVID. And that's something we'll talk about a little bit as well. So when we do our research and our R&D and our end, we look at what are the top issues affecting health systems. We know the workforce challenges, there's different things that may be challenged within an organization. Bringing the right technology and patient safety and quality, Government mandates always putting a stress on everything. Patient satisfaction has been, more important than ever. But there are two that have been rising quicker than the others. Financial challenges is the one that's always, obviously a focus of everyone. But then personnel shortages, that's the yellow line you see here. And that is really growing at a rapid rate. It's estimated to be a shortage of providers and nursing staff over the next decade. So we're seeing this really rise. And when we talk to a lot of our clients and organizations, this seems to hit home with a lot of people, that there really is a significant shortage of personnel here. So what does that mean, right? What does that mean, personnel shortages? What is that doing to an organization? And it's talking about, number one, it's that burnout that we talked about. So, in a typical day, providers are being asked to do more with less resources. They're asked to see more patients, right, with less staff, less resources. 3 and 5 physicians, spending a full day just doing administrative work, right? So how can we help that? How can we take that burnout, off of their plate? How can we make it easier for them? We see declining reimbursements, we see rising costs. So when you think about how does this impact, your practice, it's really about, how can you be more efficient, right? How can you provide your staff with the right tools, the right equipment to see that growing patient population? And to be able to do more with less resources. And the way you do that really is technology, and putting the right equipment in place and really setting up your staff for success. And then, we look at healthcare as, consumerism as well. We're all, all of us here on this call, we are healthcare consumers, right? We've all been to doctors for our family, for ourselves, and we know what a good experience looks like. We know what a bad experience looks like, especially if we're in the industry, right? We judge it more closely. So when you think about, the Amazon Prime on-demand world we're all in today, we want to make an appointment same day. We want to be seen quickly. We want to have a great experience. And when we leave, a lot of us will leave a review on how that experience went. So, this is really changing, that consumerism aspect of healthcare, especially in the urgent care space, because there's a lot of competition out there, and really you're competing for patients and you're competing for staff members as well. So really the better experience you can provide, that's when your clients and your patients come back and, pick you as their provider. So shifting a little bit here is we call quintuple aim. So many people have different types of OKRs or objectives or goals as an organization. So you may call this, may have different terminology for these, but this started out as triple aim. So if you start on the left, every organization wants to improve care experience. They want to have healthcare population, right, to be able to have the patients under their umbrella and reduce their cost. This is how this started as a triple aim. There was one important piece that was missing out of the triple aim, and that was where it evolved into quadruple aim, and that's care team well-being, right? You can't be a good caregiver and provide good experience for your patients if you yourself as a caregiver, doesn't have the right tools or doesn't have the right support around you. So you'll see as it evolved into quadruple aim, that care team well-being was added to that. Now, one important thing to note here is you can't sacrifice one, for the sake of another. So you can't reduce your costs, right, by, skimming out or saving some pennies here or there by the sacrifice of your patient experience, right, or sacrificing your care team experience. And then now it's evolved into quintuple aim, where health equity was added. And what that means is really same access for all, right? Being able to see all types of patients, having access to every patient, whether it's ADA accessibility, whether it's, them having access to your facility and being seen by a provider. So you can see that, this might connect with many of you out there, right? We look at patient experience, care team experience, reducing your costs. These are all things that we're looking at, as you're growing and as you're developing new practices. And the one thing that Midmark does is we develop our equipment and different technologies that Midmark introduces. We're always coming back and connecting the dots to this. How does this help the patient? How does this help the provider? How does this help the organization reduce costs? So a lot of things that Nate and I will share with you today is we'll always come back to this and how we can accomplish, some of these quintuple aim goals that a lot of the organizations have. So here shows an image of a typical exam room. We call this a traditional exam room. Many of you may recognize it. You may have some of this equipment in your organization today. This is all mid-market equipment that you see here. Looks clean and nice on the surface. But when we start diving into, the workflow, the layout, and again, back to that patient and staff experience, there's a few challenges and bottlenecks that we want to point out for you to consider, as you're looking to redesign or design new practices. The first being, scale in the hallway. This could be a privacy issue, could be a bottleneck issue for the staff and the providers, could be a safety issue, right? Somebody with a walker stepping onto a scale. So something to consider there. When we work around the room, we look at the exam table. This is what we refer to as a fixed height box table. An elderly patient a lot of times have a hard time getting onto this box table, stepping on that pull-out step stool. She's getting her blood pressure taken, with her feet dangling and not touching the floor, talking to the provider with a manual blood pressure cuff. So when we think about some of the problems with this is, really when you get your blood pressure, your feet should be supported on the floor, your back should be supported, the arm should be at heart level. This is a manual device that does not go into the electronic medical record. So you think about this has to be manually transcribed into the patient records after that is taken. We look at the computer on the countertop. So as we know today, technology is in every room and it's here to stay. So really, that's not a great location for that computer where the provider's back would be turned to the patient, or thinking about ergonomics, right? They're not in the proper positioning to really engage with that patient. And then lastly, the cabinetry, wood cabinetry that's, say, similar to kitchen cabinets or millwork, that's really not conducive to a medical environment and not designed to hold up over the long term and really wipe down to be cleaned. So these are some things that we'll continue to talk about as we work through the presentation. But just kind of wanted to highlight, again, many exam rooms are set up this way today, but there's a lot of small adjustments that could be made to, again, back to improving that efficiency, to improving that workflow. I'm going to pass it off to Nate here to take this next little section.
Great. Thank you, Ron. Very much. Appreciate it. And thanks, everyone, for joining today. We want to share some new industry news. Okay. Yeah, there we go. So with some industry news in regards to safety risks. So this is really centered around ADA compliance and also creating an environment that is conducive for the patient and in regards to health equity, care team well-being, and really a better overall patient experience. So this is some new industry insights. The U.S. Access Board has been around since the 1970s. It's an independent federal agency dedicated to ensuring accessibility for people with disabilities, promotes equality by developing accessibility guidelines and standards, and it coordinates across federal agencies to ensure consistent implementation of accessibility laws. So they've been around for a while. In the early 1990s, in fact, they were, very helpful in regards to government buildings, putting ramps to doorways, accessible bathrooms, you name it, across the country. And part of the Affordable Care Act that was enacted over a decade now, the U.S. Access Board met for a number of years and wanted to put forth what they deemed as ADA compliant equipment for the exam and procedure room, as well as other areas of the clinics. And they put forth some initial findings in 2017 that we're going to cover. And finally, in September of 2024, they put forth their final findings that we'll cover as well. But you can just see here from the screen, what we look at is an exam room holistically and how we can design that space to accommodate all patients. What's important is giving those patients their own dignity to safely transfer onto an exam table and get the proper exam that they deserve. So that's where this health equity comes into play. You can just see here from these photos, the picture tells 1,000 words. You've got clinical staff trying to potentially lift a patient onto an exam table. One of the major workers' comp issues in the United States is actually from the healthcare field, that being nurses having bad backs. So if we can have the right equipment in the facility to accommodate all patients and their needs, a wheelchair, walker, obese patient, to access the exam chair. That makes it that much more streamlined and a better clinical workflow and a safer workflow for the staff. So with this industry news, facilities must be compliant with scoping requirements from the 2017 U.S. Access Board standards that were put forth. And this needs to take place by August of 2026. So under the ADA Title III, it applies to private businesses that are considered places of public accommodation, which includes urgent cares, doctors' offices, hospitals, and pharmacies. And so the Department of Justice and the Health and Human Services will require a minimum of a facility to be 10% compliant. And that is by August of 2026. So the way that works is, for example, let's say there's an urgent care clinic, you have 8 exam rooms, they have all fixed height box style exam tables. You'll need to add at least have one ADA compliant exam room in that facility before August of 2026. So if you have another clinic, for example, that might be 12 exam rooms, you'll need 2 of those exam rooms to be ADA compliant with the correct equipment. So this is all wonderful news for patients, for providers, and for clinical staff. And it does create a better workflow, which we'll cover. So the 2024 U.S. Access Board standards, this is what is the final findings that the U.S. Access Board put forth in September of last year. And it really there's 4 pillars of the equipment within an exam room pertaining to an exam chair, exam table. That being a seat height of 17 inches or lower, with the transfer surface, as you can see, 21 inches in width, 17 inches in depth, and also a base clearance of 26 inches in width as a maximum, meaning it gives the ability that if a Hoyer lift is ever needed to be brought into a clinic, that Hoyer lift can get around the base of the exam chair, exam table. But what's important is also the transfer supports. We're going to cover what I mean by these transfer supports. That's also encompassing with the exam chair, the exam table. So currently, right now, what's being enforced come August of 2026 for the DOJ and the Health and Human Services is the 2017 U.S. Access Board standards, which is that 17 to 19 inch range for low seat height. What we've seen in the past is in time they adopt what the U.S. Access Board puts forth. Currently, right now, they have not adopted the final findings, but we feel very confident in time those will be adopted. So stay tuned to that information. And what we have here is what I was speaking of is this patient support rails. These are products, an accessory, I should say, that needs to be on the exam chair, exam table at all times for ADA compliance in that exam room. And these actually are designed to come on or off the chair without tools. So if you've got a patient that needs this, it's available for them. It allows for a grab bar that extends till the end of the exam chair, so that if you had a patient that was in a wheelchair or in a walker, they could safely get onto the surface of the exam chair, hopefully with their own assistance, their own power, depending on how disabled they may be. So that's our patient support rails. And we have a few versions of these as well that we'll cover a little bit deeper. There's some clinical advantage to this as well, but it's all encompassing, not only the low height for the exam chair, but also those patient support rails for safe patient handling. On top of that, when you have an exam chair that has stirrups, you also need to have the knee crutches. And these are something that certainly do not need to be on the exam chair at all times. This could be something that you could put on when needed. But again, from that health equity standpoint, it puts forth the right equipment when needed for every patient that might be coming into the clinic. So these can then support a patient that may need a lithotomy exam, pelvic exam, but yet they can't support their legs. On top of that, the exam chairs from Midmark, from Ritter, also have the ability to have a clean assist feature. So we have some models that this comes standard, some this is built in the factory, but this is a wonderful feature that allows for caster wheels to be engaged when needed. For example, if you ever need to maneuver an exam chair within an exam room for a patient that has some special needs, that can be done. There also gives you the ability to clean the floor. From a cleanability standpoint, it's really hard at times to clean those floors. You have to maybe wax or clean around it. And this allows for not having to have maintenance people involved. They can easily, safely engage these levers in the back of the exam chair and then lower down, and those caster wheels become engaged. Move them in place wherever it needs to go within that exam room, and then you can then power it back up, and those wheels are then locked, and the exam chair is stationary for the next patient. So it's a great feature. On top of that, from a clinical workflow standpoint, what we have is an ADA compliant exam chair that also allows for perfect patient positioning for blood pressure capture. Blood pressure capture is such an important measurement in healthcare. And unfortunately, it's really being done across the country, sometimes in error. And so, for example, what you see here on the left of the screen is a fixed height box style exam table and a manual blood pressure capture. And as you can see here, it's difficult. Sometimes, you're talking to the patient's talking to the caregiver. It's hard to maybe hear that K sound on a manual blood pressure. And also their feet are dangling, their back is not supported. They're really not in a great position. And this also comes into play sometimes with white coat syndrome. White coat syndrome is real. You may go to the doctor and feel uneasy, and those blood pressures are higher than they would be normally. So these ADA compliant exam chairs, what they do is they allow for a better way for better blood pressure capture. This allows for 97% of adults to get their feet on the floor, their back supported, and their cuff, the blood pressure cuff, at heart level. So in essence, this is the perfect positioning that you can have a comfortable blood pressure capture and really can eliminate that white coat syndrome. And also more accurate data, better information. So clinically, the team can make a better decision and not over medicate a patient or under medicate a patient. And so that's really important. So Midmark did a lot of third party studies with the equipment. And what you see here on the screen is an example of, from our observations, from our test groups that we had, and these were hundreds of clinicians across the country. You can see, for example, having a better blood pressure foundation or design will really create a more accurate blood pressure test, with the same patients being tested on a box style table and then on a barrier-free ADA compliant exam chair. So really good stuff. So this is the family of exam chairs that all meet the 2017 US Access Board ADA compliant regulations. And the Midmark 626 is one that goes a little lower, 15.5 inches low. It also supports 650 pounds of weight. And this is great for just pure natural gravity. Most wheelchairs are around 18, 19 inches in height, but you can certainly get a patient transferred onto this chair quite easily because it goes lower than the wheelchair. It also has the ability to be ordered in the factory with a scale. You can actually have a scale embedded directly into the Midmark 626, and that can capture a patient's weight in pounds or kilograms up to 650 pounds. But this would really kind of accomplish two things within the clinic. It would give you then obviously an ADA exam chair or exam table that meets those ADA requirements, But what it also does is it gives you a scale that is compliant as well. And this is fantastic because if you think about it, the patient needs to be examined. So it makes more sense, instead of having to take them to maybe a wheelchair scale down a hallway, which is taking up valuable foot space in the clinic, you can bring that patient to the exam room directly, get them onto the exam chair, capture that weight, and then capture those important vitals measurements right then and there. So it's a great, great solution. And this can be done in pounds or kilograms. And you can even capture the patient's BMI if needed from the hand control. On top of that, obviously, procedures are still being done in urgent care clinics. And this would give the ability for you to have multiple positioning for a patient. We do have now, finally, we're the only manufacturer currently that has a procedure chair that meets the ADA compliance standards, the Midmark 631. We're super excited about it. Just came out in May, and you can see here it can do multiple positioning, 8-way power, and it's a great product to have, or a great solution to have for maybe one of your urgent care clinics that's doing a little bit more acute type work. This can be kind of captures all of that for you. So you can see Midmark has quite a powerful portfolio, really creates a complete ecosystem. This is definitely a more streamlined design, better clinical workflow. Everything that's pictured in this room right here, this exam room, is all Midmark product, except for the artwork on the wall, the soap dispenser, and those sundry jars. But that's all Midmark, and that can really speak to what we can do to help your organization. We also have quite a portfolio when it comes to our diagnostic line. So we have a wonderful partnership with Heine. They're a German manufacturer, and they are the market leader in all of the world, except for North America and Canada. Wonderful products, and these are one of those otoscopes, ophthalmoscopes that once you get it in the clinician's hands, you can see how well built it is. On top of that, we have a full range of digital vitals devices depending on the form factor of the clinic. So we can meet your expectations for laptop use. If you're maybe on electronic medical record where you need to have a computer monitor on a wall, we have a solution for you there, where it has you can see from the screen here, a monitor arm, wall mount computer workstation with a vitals device directly embedded into it, as well as more of a standalone unit that could be on a wall mount or a mobile stand. So just some different form factors. And the key here, these products are all integrated into multiple electronic medical records. Our ECG actually is the market leader in terms of digital ECG and integrating into electronic medical record. And I'll show you what that looks like. So there's two different things. There's an interface and an integration. And Midmark is fortunate. We have integration, again, with over 80 electronic medical record partners. And what that means is there's no middleware. So with an interface, you have typically a middleware or another software that connects the product, the acquisition device, to the electronic medical record. However, with an integration, that's not the case. So if you went into the patient's chart with an integration, literally, you could acquire ECG through the patient's chart. You then go into our product where you see a digital screen going across the computer, and then you can then save that report directly to the patient's file, and which is wonderful, because if you had a patient that maybe came in multiple times over a certain time frame, you can even do ECG comparisons and see how they're doing. So it's wonderful technology, and that's really has helped many organizations get their arms around having better data within their clinical EMR. On top of that, we do the same thing with our vitals devices. Again, we have multiple form factors, but you can see here, complete integration. You go into the patient's chart, you then acquire that vitals test, and then that information is dumped and imported directly into the patient's chart. So good data in, good data out. It's very powerful. On top of that, obviously, one of the key components for any clinic is, especially with that relationship between a patient and a caregiver, is that eye-to-eye contact. The computer's here to stay. It's not going away. It's just a matter of how do we use that computer within the clinical exam room. And Midmark has a wide range of computer workstations that allow for that eye-to-eye capture to take place. But what's great about it is we meet the 95% tall person and the 5% short person. If they want to sit or if they want to stand, the computer workstation from Midmark reaches that 49-inch high height. So for a person that's 6'4", or goes down to 23 inches for a person that might want to sit that's at a 5-foot height. And that is just a wonderful range. A normal desk height is 30 inches, but again, we go down to 23. So it's very low. And there's quite a wide portfolio that we offer, depending on the form factor. Again, if you've got thin client, a laptop, a full PC, you name it. We even have powered carts as well, if you want to have a powered solution. And then we have a full range of wall-mounted units as well. So that's a big piece of the puzzle, is where do you put the computer in a clinic? Where do you position it? We have those solutions, which is fantastic. And then on top of that, again, we have a wide portfolio. These are some other solutions that we offer, a full range of clinical seating. We're very, very popular with our side chairs, wall saver design side chair that's easy to put into place. If you've got an unlevel floor, you can level that off quickly. On top of that, LED lighting, full family of LED lights that could even attach to the exam chairs if needed for pelvic exams. And then we also have our desktop sterilizers. So this is our next generation Midmark M9, Midmark M11 sterilization units that just came out to market last year, and super excited about this product line. We are the market leader for desktop steam sterilization in the medical ambulatory care environment. So very excited to also not only that, but share with you what Midmark can do in terms of helping you design perhaps a better clinic. And these services that Ron is going to touch on is available to you at no charge. So thank you.
Yeah, thanks, Nate. I'll take the wheel back. Just to sort of add on to what Nate was talking about with the vitals devices and the connectivity to EMR, to connect that dot back to the quadruple aim that we were talking about, right? That's where we're talking about efficiency, reducing waste, reducing cost, right? So when you can have an efficient exam room like that, where everything is connected to your EMR and everything is seamlessly going in, think about the time savings that comes into play with that, right? See how many more patients can be seen, if you're shaving off minutes per patient, how many more patients can you see? So that's kind of one thing we talk about when we're saying that patient experience, the staff experience, reducing waste and reducing cost, and how we can kind of bring those products back to that. Think about how it connects to your objectives and your key objectives. So just to kind of highlight a couple of resources, again, that Midmark can help with is, we're really not just a manufacturer, we are a design company. So our goal is to work with you closely early on in your projects, collaborate with your architects, and really help you design the best space possible. And then once the design is, in place, then drop in the right equipment and drop in the right technology. So what we're showing on the screen here is, a 2D floor plan that the architect would typically put together for you. And again, we're not taking the architect's place, we're really collaborating with them, right? The architect's going to be responsible for laying out the space as a whole. How many exam rooms, where are the bathrooms, electrical, plumbing, nurse stations, really giving you a complete layout. Where our expertise comes into play is that clinical space. So those exam rooms, those procedure rooms, sterilization areas, labs, right? What you're doing in these spaces, and the types of patients and demographics you're seeing. So oftentimes we'll have an initial conversation, what we call a discovery, where we want to learn about your practice, learn about what kind of patients you're seeing, learn about, are you seeing ADA, handicap accessible patients, patients with special needs? Are you seeing elderly patients? What's your demographic? So we can design the rooms to really fit, your best approach. And what we want to do here is really help create renderings and visualization for you as you're designing the space. So you can see in the middle, we designed, create some 3D models and renderings, and then really dive into what a complete exam room looks like. So, where the sink and the storage is going to go. Typically, the plumbing location is going to dictate the rest of the room layout. And there's different ways you could accomplish and lay out an exam room. But, as Nate mentioned about the computers, what kind of a computer are you using? Is it going to be a laptop or is it going to be a full PC? Is the diagnostics going to be in the room, or would an MA be wheeling it around the clinic, right? There's different ways you could do this. And then, positioning the exam table to make sure they have their privacy and not exposed to the doorway when it opens up. So this is one resource where we work early on, before we even start talking about the equipment, really helping you design the space to give you the best workflow and the best for your staff. This will show some different images of what that looks like. We have the ability to put different colors in there for the upholstery, for the cabinetry and the countertops, even flooring. So really help you give, before you put any construction together, really provide that interior design aspect for you as far as the style and the looks, but then what type of equipment's going to go into that space as well. And one thing we look at a lot is, again, back to that exam room itself. Typically, exam room is say 10 by 10 or 10 by 12. So it's a small space, right, with a lot of equipment going in there, right? You have exam table, cabinetry, computers we talked about, side chairs for the family members. So what is the best way to lay this out? And if you look at the pictures on the right, we're showing a triangle there, what we call a workflow triangle. And what that's designed for is to have the patient, the provider, and all their supplies and technology at the point of care. So similarly, when you would design a kitchen, they call it a triangle, right? Where you have everything within reach and you're not walking across the room. Similarly, in an exam room where we're trying to minimize those steps for the providers. And we're also trying to, oftentimes somebody might go to the doctor with the family member, right? Whether it's a child or maybe you're taking care of an elderly family member. So we look about having a private zone for the for the patient and for the providers, and then a public zone for the family members that sort of divides the room in half. So again, this could be accomplished in different ways, but this is just showing an example of how we look at this exam room and provide that workflow triangle for the provider and the patient to have everything right there at their fingertips. And this will show, again, kind of thinking about that, designing that space, right? Cabinetry is one thing that we work closely on. And some people don't think about it. A lot of times architects will draw in custom cabinets. But really thinking about a healthcare space, there's a lot of specialty needs that you need for storage, right? What kind of supplies you're going to have in there? What type of procedures would you be doing in there? So the picture on the left just shows a fixed cabinetry, a traditional layout with the gloves and the paper towels on the wall. The one in the middle is what we refer to as more of a flexible design and a cleaner design, where the gloves can now be incorporated into the cabinetry above the sink, paper towels built into the cabinetry as well. And then you'll see a mobile cart that's nested under the countertop. So this has become real popular, especially in urgent care and procedure rooms, where you have the ability to bring this cart out and bring it to where the patient is. So now the provider and the doctor has their supplies at the exam table. They have a work surface if they're doing a small or minor procedure. It can replace a stainless steel Mayo stand that sometimes you see in a procedure room. But again, having that storage below and having all the supplies. Has the ability to be locked as well to protect all your supplies and any vaccines you may have in there, and really lends that flexibility. We've had multiple organizations use these as supply carts where they swap them out. So you may have a specialty that's there one day a week where you could bring in, let's say it's a podiatry cart and they have all their tools. So it gives that flexibility to swap these carts out and have all the right supplies, at the point of care. And you'll see some of the other areas that we focus on: procedure rooms, break rooms, labs are a big focus of ours as well, sterilization areas, anywhere we refer to as a wet area, where these are getting a lot of high volume, high use. They're going to be cleaned regularly, and you need the right storage and supply management for these spaces as well. This will show us just a couple more examples of what that cart looks like. There's drawer dividers that can go in there to help with your supply organization and management. Digital locks that can be put on there so you don't have to worry about the staff having keys or losing keys, and different types of tops and styles. So again, you can see this all matches up with the cabinetry that we that we put in the rooms as far as the colors, the styles, and give that clean, style and look to it. We also offer a procedure cart, so a more robust high cart that can be used in procedure rooms for standing height. Also have the ability to put different types of accessories like glove holders, sharps containers, even a trash can, where this again has the ability to be moved around, brought to where the procedure is happening. And then the provider has all their tools that they need, all the supplies right there at their fingertips. So, we talked earlier about, Midmark, we do a lot of research and development. Before we come out with products, when Nate talking about ADA accessibility and the changes coming down, we always try to be ahead of that, right? We always want to know what's coming up and design our products ahead of it and not playing catch up. So one thing we look at too with the cabinetry and even the workstations is ergonomics. Ergonomics is becoming more and more of a focus for healthcare organizations. Nate mentioned number one is healthcare for back pains and injuries and workers' compensation because of the lifting of patients, maybe because of bending and moving around all day. So when we look at just ergonomic reach, in cabinetry, to use cabinetry as an example, we look at what the average height of a provider is. 5'4" would be the average height of a staff member in a healthcare organization. So when you think about that, some of those high cabinets are hard to reach, right? Things that are stored up at a high level. So we don't want them getting on step stools trying to reach up. So we try to think about how can we design this cabinetry where they could see the supplies, easily reach them, not reaching or bending, multiple times a day, and help with that ergonomic reach. So this shows an example of, instead of doing a horizontal cabinet above all the way with the storage and the supplies up high, more of a vertical design with what we refer to as flow shelving. So those shelves are angled front to back. So you can see that the staff member there can easily see the supplies. Everything is a feeder system where it comes to the front and they make sure they have the stocking all correctly and all the supplies they need for the day. And you can see that that reach point is so much easier, and being able to visualize where the supplies are is so much easier. And then this is actually designed to be off the floor as well. So this is a wall hung cabinetry solution that encompasses some of the things that we're talking about, that mobile cart design that's under there, as well as that vertical tall cabinet to help with that reach point and help with the visual of the supplies. And everything's off the floor here too. So the sink you'll see is ADA accessible sink, so a wheelchair can get under there. Somebody could wash their hands, and that meets all the regulations for ADA accessibility for washing hands as well. And then think about cleanability too. So if you wheel that cart out, nothing's touching the floor. So you think about the floor cleaners coming in or the cleaning crew coming in at night, you can easily wipe down that room and get everything clean and ready for the next day. So just showing some different examples of, what the cabinetry may look like, some different styles and configurations. Those other carts you see under there is a linen cart or a trash can as well that could be mobile and flexible. Plexiglass for the doors to be able to see some of the supplies that are in there. That's real popular at a procedure room setting. So lots of different options and styles. Even above the cabinetry is a sloping top. That's for dust prevention and preventing your staff from sticking big boxes up there and kind of being an eyesore for the exam room. And this will just show the array of storage bins that can be incorporated into the cabinetry as well. Again, coming back to that, quadruple aim, when we think about waste, a lot of times there's a lot of waste on supplies, right? Over ordering supplies, overstocking supplies that expire over time. So we think about designing these rooms and giving you the right supply management and the right amount of storage that you're not oversupplying, and then the bins to help with that organization. So this will show an example of a sterilization area. So two things that just to touch on here is the cabinetry, number one, is designed for this space, right? You have a lot of volume here. You'll have a lot of water and steam happening in this location. So you're gonna need something that's gonna be durable and hold up and clean very easily. And then secondly is really the process and the step-by-step process that occurs when you're doing a sterilization or sterilizing instruments. And really, Midmark, this is one of our expertise, what we focus on. We educate a lot of architects on designing a sterilization space or soil utility areas and making sure it's done the right way. So just as a quick high level is, step one, you're going to be receiving, the dirty instruments. You're going to be rinsing them and preparing them and packaging them to go into the sterilizer. Step 3, you're going to actually do the sterilization. And then with our new generation sterilizer that Nate mentioned, it has the ability to record and monitor and do all the reporting and save that digitally for you. And then step 5 would be storing it in a clean, dry, dedicated area. So this shows a straight run of cabinetry. This can be accomplished in different ways and layouts, as far as L shapes or U shapes. Depending on what that room looks like, we can always come up with different solutions and designs and layouts that's still going to accomplish this workflow and this process. So just to shift gears a little bit on some other resources that Minmark can help with. I talked about working with you early in a process. We can help you design this space, help you specify the equipment that's going to go in this space. When it comes time to delivery and installation, we offer that as a full turnkey solution as well. So designing to ordering, to fully deliver and install. We have full Minmark installation teams on staff and project managers that come out to sites, do field measurements, do site visits, collaborate and coordinate with your architects and your construction teams to make sure, as far as scheduling, timing, offloading locations. So really our goal is to take everything off of your plate, not have to look to a third party or another source, but really have Minmark provide everything for you, from quoting, specifying, all the way to complete delivery and installation. And the goal is is to get you up and running as quickly as possible. Another resource that we offer is, we're kind of talking about this today, is exam room insights, right? And we offer a workshop that revolves around a lot of the topics that we're talking about today. So a lot of times we'll get your stakeholders, involved in a meeting like this. Could be a virtual meeting, could be in person, where we're talking about a lot of these topics we're talking about today, right? Operation, that quintuple aim, flexible design, safe patient handling, ergonomics, right? All these topics we're talking about today, we highlight in what we call a workshop. Where we take it to the next level is now bringing this equipment that we're showing you on the screen, to a location and setting up a mock room for you. So this will show you what that looks like, is really helping you follow your work through a simulation. And again, I talked before about looking at a 2D floor plan. Oftentimes it's hard to kind of see what that space is going to look like, without touching and physically touching the equipment and seeing the equipment. So Minmark, we have the ability for our sales team, we travel around with all this equipment in our van, and we have storage units with a full exam room that we can bring to you, to evaluate during a new project and planning process. That picture in the middle, you'll see we actually have a modular wall that we could put up where we can mount the cabinetry, the vitals devices, the computer, all on the wall to really give you what a real exam room is going to look like. We'll tape it off to give you the true size of that, put the doorway there, and have your staff and all your stakeholders come in and give their feedback on what works and what doesn't. We've done this with numerous organizations across the country, and really the feedback is, a lot of times we uncover maybe a challenge that wasn't, brought up on an architectural floor plan. So this resource is available, again, for anybody that is working on new projects. We can bring this equipment to you for demos and for a full mock room. And then lastly, we have what we call a customer experience trip. So this is an image of a showroom back at Minmark headquarters. Minmark is based out of Ohio, about 30 minutes north of Dayton, Ohio. And we bring a number of customers across the country back to Minmark, really to see all this equipment firsthand. So we have a beautiful showroom that highlights all the different exam room setups, lab sterilization areas, different specialty clinics, full dental showroom as well. And not only do you get to see the showroom, but we'll do a factory tour so you can see how this equipment is built, the quality that goes into designing and building all the equipment that we're sharing with you today. And then a full design studio too. So a lot of times we encourage the architect and interior designer to come back as well, so they can go to the design studio, look at upholstery colors, countertop colors, cabinetry colors. So everything's going to coordinate together, and they can build that board, right? That design board, so they can come up with the best design for you and your practice. And a lot of times we'll bring back, again, sometimes the construction team, sometimes the architects, the IT team, right? Connecting all those computers to the technology that we're talking about. And this is a great resource, and this is open to really bring anybody back. We love love hosting people back here because they get to really see the culture of Midmark, what kind of company Midmark is, and the passion that we have and our entire organization has really to just improving care and designing better, healthcare spaces. So with that, I'll kick it back to Samantha, where we can start some maybe Q&A. That's a wrap for our part of the presentation. So thank you so much. We really appreciate the time. And thank you, Nate, for partnering up with me on this.
Well, thank you so much, Ron and Nate, for sharing your expertise. So we're now going to open it up for Q&A. So as a reminder, feel free to submit your questions using the Q&A chat box at the bottom of the screen. We are seeing some good questions coming in, so let's go ahead and jump right in. So a question came in about patient expectations. With healthcare consumerism on the rise, how does exam room design help meet those growing demands for convenience and a better patient experience?
I'll handle that one, right, Nate?
Yeah, sure.
I think it just comes back to a lot of the topics we were talking about with that, quintuple aim, right? The patient experience. We are consumers of healthcare. We know what a good experience looks like, right? We've all been to a doctor's office that is great and we love it and we love the equipment and the providers. I think many of us have probably been to a doctor's office that isn't up to par, right? We haven't had a good experience. So I think as a consumer, you're going to come back to a place or go buy from somebody, right, where you had a great experience. There's so many choices for us out there today with different urgent care centers, different IDNs opening up medical office buildings. We all have a lot of choices. So we're going to go where it gives us that best experience, where we're most comfortable, where we know they have the most current technology in a space, right? I think when people are up to date on current technology, clean, nice equipment, and that experience is going to be good for you as a patient, that's when you're going to stick under that healthcare provider's umbrella and make that your provider.
Great, thank you so much. There's also a question about infection control. Post-COVID, what exam features or design choices make the biggest impact in reducing contamination risk?
So there's two things we look at is really the material that's going on in the exam room. So if we start with the cabinetry, for example, solid surface countertops or Corian are highly recommended. This is going to be a non-porous material that's not going to absorb fluids, blood, different types of fluids that are in the exam room. Similarly with the cabinetry itself, you really shouldn't have, a wood product in an exam room that's going to absorb these different types of fluids and really not contain that cross-contamination. So our cabinetry is designed to be non-porous. It's all seamless. It's not going to peel away or chip and delaminate over time. So that's one aspect, is really that material you're putting in there that's going to be non-porous and withstand, the everyday abuse. Even something simple as the hardware that goes on the cabinetry. We offer copper handles that is antimicrobial. That's going to kill bacteria, 99% of bacteria that's going to touch that. So little things like that. And then same thing on the upholstery. So we think about the exam tables, the side chairs, and the stools. You have an upholstery on there that you're going to want to be able to clean it, wipe down. You're wiping it down after every patient. It needs to withstand that. It has to be non-porous and not absorb, the different types of, fluids that are going to be in this exam room. So really sticking with the right material that's going to be able to be cleaned and wiped down multiple times a day, and that's going to hold up for the long term.
Righty. And there's another question left. Probably only have about a minute or two left for questions, but this one is about infection control, or excuse me, let's go on to this one. How about in the realm of improving accuracy and efficiency? So you mentioned some of the limitations of a traditional exam room. What design changes can make the biggest difference right away?
Yeah, great question. I think a simple change really is the exam chair. If you can switch out the exam chair to a chair that's ADA compliant, it allows you to do so much more from a clinical workflow standpoint in terms of getting obviously the patient on the proper equipment in the correct positioning. But from there, they can get a more accurate blood pressure capture. Again, feet on the floor, back supported, cuff at heart level. Again, 97% of Americans can sit down in our chairs, our ADA compliant exam chairs, and receive that better BP, which is fantastic. And we call our chairs barrier free. And the reason why is the barrier to entry is the footstep, that fixed height box style table. And so there's no barriers to access for ADA compliance. So really right then and there, there's numerous things we can do from a design standpoint. Obviously a computer workstation in the room for the clinical teams. But that exam chair, that quick switch out, take the old one out of the room, put the new one in, it could be done in a matter of minutes. So great question.
Great, and thank you so much for that. I think that's just about all the time we have for questions today, but if we didn't get to yours or if something comes to mind later, please don't hesitate to reach out to Nate, Ron, or myself using the contact information provided on the slide. You can also always reach out to us at admin@neruca.org, and we're always happy to continue the conversation. So with that, Nate, I'll go ahead and I'll hand it back over to you for some final remarks.
Yeah, thank you. Appreciate everyone's time. It's been great. Obviously, again, any additional questions or any opportunities, feel free. You can email Ron and myself at any time, and we can do that. We can have that one-on-one conversation. And feel free, you can snap that QR code, and that QR code is going to bring us to our end of year savings, where we have a program right now where we're literally, if you trade in an old exam table, we will take that non-compliant exam table and give you dollars with purchase of a new ADA compliant exam chair. On top of that, we have savings on our vitals devices, a bundled package as well. When you buy a Midmark 626 with patient support rails with vitals, you'll get additional savings. And we also have programs with the trade-in of our sterilizers, trade in an old autoclave, and we'll give you $500 back on that. So feel free, you can snap that QR and take a look at that. And then lastly, we're super excited. We're going to be part of the conference next week in Connecticut at Foxwoods. So stop by booth 124. We are actually going to have our equipment on hand. We'd love to chat with you, show you firsthand what we were discussing today, and let you literally kick the tires on all these wonderful solutions that we can offer. So again, thank you for the NERUCA membership. We appreciate it, and we appreciate the partnership. Have a great day.